Can ankylosing spondylitis cause osteoporosis? Ankylosing spondylitis can increase the risk of developing osteoporosis. Some lifestyle changes may help delay or prevent its development. Ankylosing spondylitis is a chronic inflammatory condition that causes stiff, painful joints, often in the lower back. In more advanced cases, it can lead to fusing joints and reduced mobility. Ankylosing spondylitis is also associated with reduced bone mineral density, which can increase a person's chances of a fracture or break. Keep watching for more information on how ankylosing spondylitis and osteoporosis are connected, treatment options, and when to contact a doctor. Research indicates ankylosing spondylitis increases a person's chances of developing osteoporosis compared with the general population. According to a 2023 study, in the study, researchers found a significant increase in the number of people who developed osteoporosis who are also living with ankylosing spondylitis. They also noted earlier development of osteoporosis in people living with ankylosing spondylitis. Their findings are similar to earlier studies on ankylosing spondylitis and bone density complications and comorbidities. A 2016 study noted that low bone mineral density is common in people with ankylosing spondylitis. The decreased bone mineral density puts a person with ankylosing spondylitis at a higher risk of developing a fracture. How common is osteoporosis with ankylosing spondylitis? Low bone mineral density can be a common issue in people with ankylosing spondylitis. In a 2022 study, researchers assessed people with ankylosing spondylitis for fracture risk using the World Health Organization criteria and fracture risk assessment tool. They found that around 13 to 20% of people met the criteria of World Health Organization and fracture risk assessment tool to begin bone density increasing treatment. Anywhere from 39.1% to 75% of the people assessed who tested positive for requiring treatment actually received treatment for bone density. The previously discussed 2023 study also found that people with ankylosing spondylitis are more likely to develop osteoporosis compared with other populations. People with ankylosing spondylitis may want to discuss their risk of developing osteoporosis with their doctor. They may be able to take steps to help reduce their chances of developing it. What are the symptoms of osteoporosis? Osteoporosis is a condition in which a person's bone density is low. This increases the risk of fractures or broken bones. Osteoporosis is a silent condition, which means that a person may not know they have it until they experience a fracture. A person with osteoporosis may experience a break spontaneously when bending over or lifting a heavy object due to a minor fall. If a break occurs in the back, a person may experience deformity, hunched back pain, or loss of height. It is best to contact a doctor if there are concerns about osteoporosis. If a person is at risk, the doctor may order tests. How do doctors diagnose osteoporosis? In most cases, doctors diagnose osteoporosis during routine screenings. The United States Preventive Services Task Force recommends screenings for people assigned female at birth over age 65 years and females at any age with factors that increase their risk of developing osteoporosis. As part of diagnosis, a doctor will review a person's health history and family history. They may also perform a physical examination, checking for possible signs such as changes in posture, overall muscle strength, gait or poor balance, height reduction. They may also order testing to check bone density as part of the diagnostic process. A doctor may also order tests to check for osteoporosis if a person experiences a fracture. Treatments for osteoporosis with ankylosing spondylitis. A person with both osteoporosis and ankylosing spondylitis has several treatment options. Home remedies. They may also be able to make some lifestyle changes to help, such as taking calcium and vitamin D supplements, exercises such as resistance training, avoiding smoking and second-hand smoke, avoiding alcohol or consuming it in moderation. Medical treatments. Medical treatments can also help. Bisphosphonates can help with reducing bone density loss. Other medications that may help include calcitonin, estrogen antagonists, estrogen and combined estrogen and progestin, parathyroid hormone PTH analog and parathyroid hormone related protein analog, rank ligand inhibitors, sclerostin inhibitors. Protecting against falls. Several measures may help reduce the chances of falls, which may help reduce the likelihood of a fracture. Some recommendations include using assistive devices such as walkers or canes, installing bars in the shower or tub, using non-slip rubber mats around wet areas such as in a bathroom, avoiding walking in socks or other slippery footwear, lighting all stairs well, oiling shoes or sturdy footwear around the home. A person may also wish to consider getting a personal alarm system in case of falls. When should a person contact a doctor? A person with ankylosing spondylitis should consider discussing their chances of developing osteoporosis with a doctor at the time of diagnosis or any time afterward. A doctor can review additional risk factors and help determine if they should take additional steps to help reduce the risk. Some other risk factors for osteoporosis include lifestyles involving chronic heavy drinking, smoking, and low levels of physical activity, taking certain medication such as proton pump inhibitors and cancer-treating drugs, living with other medical conditions such as HIV and endocrine disease, not getting enough low vitamin D and calcium. Body size, as people with slender and thin bones have a higher risk. Older age. Sex, as females have a higher risk compared with males. Changes in hormone levels. Family history of osteoporosis. A 2021 literature review notes that ankylosing spondylitis occurs more often in white and Asian populations, primarily people of Chinese descent, compared with people of African descent. Research suggests this may be due to the presence of the human leukocyte antigen or HLA B27.